how to lower blood sugar without medication. If you have been struggling to keep your blood sugar level steady, then you may have asked this very question. If that's you, then you're in the right place because we are going to answer that question in today's video. So let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, chiropractic, board certified in sports medicine, and specialized in clinical nutrition. In this video, we're going to be covering the most common reasons why your blood sugar is going high. And guess what? It doesn't always have to do with what you're eating. Then we'll cover the best ways to naturally lower your blood sugar levels. These are not things you generally hear from traditional medicine. And finally, I will be sharing with you the behind closed doors method for ending blood sugar regulation problems once and for all. Let's dive in. What are some of the most common reasons why your blood sugar is continuing to be not regulated and going high that doesn't always have to do with diet? Let's get into those. The first one would be caffeine. Now, believe it or not, your blood sugar can actually elevate after you consume caffeine. So if you are monitoring your blood sugar level, you can always test this out on yourself. Have your cup of coffee and within the next hour, check and see. And this doesn't have to do with, are you eating a mocha frappuccino that is loaded with sugar? Obviously, we know that that itself would increase your blood sugar level, but the caffeine has a way of actually being able to elevate blood sugar levels as well. Believe it or not, another source that could actually elevate your blood sugar level are a lot of the sugar-free foods. Now, why is that? Not necessarily because of the substitute that is there, but the amount of starches that we normally find in these sugar-free foods as well. So you really want to pay attention to not just sugars, but total carbohydrates. And if your total carbohydrates are more than just a couple of grams, it's probably something you don't want to consume. Now, here's one, unless you've regularly been watching your blood sugar level, that you probably aren't very aware of. If you end up with a bad cold or some type of an infection, maybe even a low-grade chronic level of infection, then that infection itself will spike your blood sugar levels or just keep them high longer. Part of the reason being is your body is going to elevate your blood sugar level to help fuel your guys that are there trying to fight the bad guys off. So it is a normal process, but that's part of what could be doing this without you even knowing it. And like I said, it's the underlying, you don't have symptoms of a chronic infection where if you can't get your blood sugar to normalize and you're doing everything perfectly, maybe there's an underlying infection somewhere, whether it's in your mouth or somewhere in the digestive system, you name it. This could be a sneaky silent one. What about this one? Stress. Yep, believe it or not, stress can elevate your blood sugar levels, and it's partly because of the different hormones that your body releases when you're stressed. They end up elevating blood sugar level. So figuring out how to manage stress is really important to help you normalize your blood sugar levels. Another non-diet related aspect that can elevate blood sugar are different types of medications. So if you have ever been on a steroid or if you're taking a diuretic or a water pill, you can expect that your blood sugar levels are going to elevate as a result of being on those medications. Another type of medication that could end up driving blood sugar upwards are cold medications. Specifically those that have some level of epinephrine in them, that is going to elevate blood sugar. And then also, there's cold medications that just contain sugar in order for you to be able to tolerate them. A different type of medication to maybe just be aware of are birth control pills. And how we are regulating estrogen levels can affect how our body is regulating insulin levels, which insulin is the gatekeeper for helping us keep our blood sugar normal. So if you're on a birth control pill and you cannot regulate blood sugar levels, it may warrant having a little exploration of that particular medication. The obvious of this with the diet is sugar or foods that are higher glycemic foods, meaning that your body spikes blood sugar high as a result of consuming the food. One way to think of it is it's almost like the body converts them to sugar, okay? High glycemic foods, sugar itself, lots of carbohydrates from non-vegetable sources are all going to be dietary aspects that absolutely can challenge you being able to keep blood sugar levels normal. I'm curious, did you have any idea, specifically the non-food related topics that I just shared, do you have any idea that those could be part of why your blood sugar is still running high? Let me know down in the comments below. I can't wait to hear your feedback. Now, what are the best ways to start naturally lowering blood sugar? Let's get into those. Obviously, the first one would be all about diet and making sure you're reducing the amount of sugars and carbohydrates that you're consuming, and that your carbohydrates are coming from vegetables predominantly, low levels of fruit. That would be huge. Ultimately, what that looks like is you're eating less carbohydrates and you're eating more of the good, healthy fats and moderate amounts of clean proteins. Another way to improve this is to increase your activity. I want to share a story with you of one of my patients. Now, my patient actually fits a lot of what we were already talking about. Part of why she came in is because she can't get her blood sugar to normalize, and the doctors can't either, no matter how many different medications they've thrown at her, including insulin. So she and I are on our own journey trying to figure out what actually caused this problem. And there's a few different factors that are actually going on in her system. One of the ones that rings true for her is she actually has low-level gum disease. So she has this chronic infection ongoing that is challenging blood sugar level regulation. Okay. But one of the other tools that we've used for her to normalize blood sugar is just a little bit of activity. She came in to see me one day and she had to quick grab something to eat because she hadn't had food all day long. And now, of course, her blood sugar was starting to spike. And she told me, like, hey, I just need to do some insulin first before I get on your table, because she was seeing me for a chiropractic appointment that day. I'm like, we're not going to mess anything up by delaying you doing that by about 10, 15 minutes. So let's do an experiment. So what I had her do is I had her start marching in place and had her do a few air squats and had her move her arms around. And I did that for just a couple of minutes and I had her recheck her blood sugar. And wouldn't you know, it was starting to decrease. So I had her get on my table. We went ahead and did her treatment, and we rechecked her blood sugar level in about 15 minutes. And it had still continued to decline just from that little bit of activity that I had her do before she got on my table. You see, if your blood sugar goes high, one of the fastest ways you can get it to start normalizing again is moving the big muscles that are in your body. They are what use sugar. So they burn sugar. If your sugar's high, exercise. Now, this isn't saying to not try to regulate your sugar levels and how high blood sugar is going to spike by choosing better choices food-wise, but this is something you can use in conjunction. So it can be anything. Like I said, I've had people who are bound to a wheelchair that are having blood sugar regulation issues. They can't use their legs, their lower body, but if you have them move their arms up and down, they can burn blood sugar that way. So just move, squats, marching in place, moving the arms around, and then, test it out. If you right now are testing what your blood sugar levels are, do it beforehand and then do some movement and see what kind of impact it has. This is one of the safest, most effective ways to bring your blood sugar level back down. And by the way, if you're on the insulin, getting to a place where you're using the most minimal amount of insulin is incredibly important. Because the more insulin you use, guys, long-term, the more negative health issues you're going to have. And generally, people have shorter lifespans. So the more insulin you use, different way to say that, doesn't sound really nice, but let it be a wake-up call, faster you end up dying. And it's not a pleasant journey either. Okay? So get your blood sugar level regulated and try to use the least amount of insulin possible if you're someone who has to use insulin at this point in time. Another thing you can try, and this goes along the lines of what are you choosing to eat? You can do smaller meals that kind of help normalize blood sugar regulation. Or you can eat, like I was saying, more healthy fats and lean proteins, clean proteins, and less carbohydrates. And you don't have to eat frequently then, because you get more lasting power out of those really good healthy fats. And they help you naturally start lowering your blood sugar levels. So those are just some easy tips, strategies that you can implement right away to naturally start bringing down your blood sugar level. Now, before I get into the behind closed doors method to help you end this issue once and for all, I just wanted to take a moment to remind you to click that subscribe button right down below, turn the notifications on, and give me a big thumbs up while you're down there. I appreciate that support. I am regularly producing videos for you specifically, teaching you how to take back control of your health so that you can become unstoppable and achieve what I like to call total body mastery. I don't want you to miss out on a future episode. So again, click that subscribe button, turn the notifications on, and give me a big thumbs up. And that way I will see you in future episodes. Okay, what is this behind closed doors method to help you end this issue once and for all? It's a process, and it's not one you're going to find within the standards of care with traditional medicine, okay? Ultimately, what we have to do is we have to figure out why your blood sugar is elevating. And is this purely just diet? Not always. Sometimes there's these other underlying issues. As I mentioned with my one patient, we found that she has a chronic low-level infection. So we know that that has to be addressed in order for her blood sugar to ever start normalizing. So we're in a process of getting that done. And she's working with, a dentist who is helping with treating that. And I'm working at helping support her immune system through that process. But guess what? Also found she had really high levels of different heavy metals. One of them being lead. Lead is also something in your system which it doesn't belong there whatsoever. But guys, it's really common. I find it all the time in my patients. If you're not testing, you're guessing. If you're not actually asking the question, you'll never know it's there. But it itself can dysregulate blood sugar. Okay, so we're working on that. We're working on other different imbalances within her system, different deficiencies. We are working at shifting what she's eating and how she's exercising and how she's managing stress. Because believe me, this woman is under extreme levels of stress. So the only way to truly know how to regulate your blood sugar level is we have to be able to step back, get the aerial view of what's going on in your world, what's going on with your body, your overall health and well-being. What is not working the way that it should be? We have to find the cause of why you have the issue in the first place. Once you know the cause, or if there's a few causes that are going on, once you know that, then you can have a proven solution to move forward and actually address it instead of just managing blood sugar levels, instead of just managing symptoms. When you manage symptoms, you never ever fix the problem. And I have people come to me like, oh yeah, my diabetes is in check. I don't really have it because I've taken medication for it. What would happen if you stopped your medication at once? Which I'm not saying do that. But what would happen? Your blood sugar levels would increase. Your hemoglobin A1C would increase. Things would go crazy because the medication is suppressing that information. It's like it's masking it. People understand this more with if they're dealing with pain, they go to see a doctor to have it evaluated. Oftentimes, if they are taking ibuprofen or, naproxen or some other over-the-counter non-steroidal anti-inflammatory drug, they're not going to take it that day because they don't want anything to be masked so that the doctor, when they evaluate them, can have a true understanding of what's going on. Medications always mask the problem. So if you have high blood pressure and you're on a high blood pressure medication, it didn't fix your blood pressure. It just masks the fact that you have a blood pressure problem. So you take the medication away, the blood pressure is going to go right back where it was because it's not finding and treating the underlying cause of why you have that issue. So the only way for you to get over this is to figure out why you had it in the first place. So once you actually know what the cause of the problem is, then you can truly apply a solution that's going to fix it. And that's what's ultimately going to help you be able to take back control, complete control of your health. Where do you start though? The best place for you to start is really figuring out dietary wise, what do you need to do to continue to improve your health? And if you improve your health enough, you shouldn't need these medications that you might actually be on, right? So I've got you covered. Down in the description below, click on it so it expands. What I want you to look for is the 7-day full body reset meal plan. This gives you the blueprint of what it looks like to eat for proper blood sugar regulation. This is what it looks like to reduce inflammation. This is what it looks like to start fueling the body with what it needs in order to be healthy. That's what I've got for you guys today. I appreciate you being here, and I can't wait to see you on a future episode. God bless.